navigating the healthcare system. So as most of you know, if you have a special needs kid, our healthcare system is pretty divided. We have a lot of kind of specialists that want to take care of each and a little piece of your child. Some communities have their hospitals are putting together complex care clinics because they're recognizing the need of this for people to have someone to put their child kind of back together in one piece. For us, that's really important. I think that's how I end up with so many special needs kids, is that we think that it's important that all the aspects of a child be seen together. So as we go forth with our specialist appointments, a lot of times, we come back and circle back, and sometimes we just have conferences where we talk about what were your recent specialty appointments? Do you have questions? Is there anything in that concerns you? And sometimes that means I call a specialist to get some clarification. Sometimes I call them and tell them that like the reason their plan's not going to work because it conflicts with some other plan that another specialist has. And shockingly, they don't always talk to each other. I think that coordination of care is something that all children with special needs need if they can have it. And there's multiple different ways that you can accomplish that. For us, and I would hope that other families can find this, I think the most important thing is for people to say, like, if you're interviewing a pediatrician or you're looking for a practice, like, do you have a lot of special needs children? Do you find them challenging and interesting, and do you enjoy taking care of them? And I know that seems like a question you're not sure you'd be bold enough to ask, but there really is a difference between the doctor who feels overwhelmed by a complex child and one that feels kind of challenged and interested in helping them. And certainly I think that's how I ended up with so many of my patients is I like interesting puzzles. I like things that are difficult. So that makes it a lot easier for me to take on the challenge of a complicated child. If they already have that in them and they've done it a lot of times, it gets easier and easier and easier. The complex things that happen for patients are somewhat unique to individual diagnoses and sometimes not so much. So I now have enough complicated children that they have shared issues and things that they have, even though they may technically have different diagnoses, they come together with similar things. And so my advice to families would be like, take that opportunity to ask a few people, like who in town is taking care of complicated patients, who is willing to take on a challenge and coordinate that care. And it could be a lot of different people. It could be at a children's hospital complex care clinic. It could be a primary care pediatrician. It could also be, there's even some like advocates that some people have hired to help them navigate the system as well. They're obviously not physicians, so not quite as good, but sometimes they can be helpful in just like navigating a complicated healthcare system if you're struggling with that. The other thing that we do a lot of is we integrate in holistic care and obviously my osteopathic treatments along with mainstream medicine. And I think that families need to know that, because when you have a patient with a unique diagnosis, one of the gaps in our healthcare system is that you think that that you're going to go to this specialist and they're going to tell you what to do. And one of my families, one of their children had leukemia, and their other child had a complex mental health, like developmental neuroinflammation problem going on. And she said to me that, her child with leukemia was just so much less stressful. And because even though his life played in danger every day and she could wonder if he was going to live or die in real times all the time during his treatment for his leukemia, the path was clear for her as a mother. The oncologist knew what to do. They had a protocol, they had systems in place, they had an organized system as to how to take care of them, and she just needed to show up and do what they said. And that was easy, and it really was easy. I mean, I still helped her coordinate that care, but frankly, the oncology team did a great job. It was rare when we had to advocate for him in some way that was unique. But the patients that have neurodevelopmental issues and unique diagnoses, and of course your population would be in that category, there's just nobody has protocols of specific things for them to do. So the person that takes care of them has to be comfortable with gray and things that may not be very clear in their path. And that is a certain personality of physician as well, a dying breed, I might add. There's not very many of us left. And so um, those integrated care, the holistic cares that we do, is really nice for families to have some tools in their toolbox that are safe and reasonable, that they can bring alongside to the care of their children, and supplement that in with their care. That's a big hot, like a big hat or umbrella of topics. Um, and the notion that some people say integrative medicine or complementary medicine or CAM medicine, and they refer to a whole bunch of different things. They could go all the way from like autism families who might do chelation for their children, or IVs of, experimental medications, to diets, to acupuncture, or what I do, which is osteopathic manipulative medicine with my hands. And, I don't like that the medical community who doesn't understand what we do kind of lumps all of those things together, because they're very, very different. And so I would like to take a minute to kind of put those piles in a pile. Okay, so if you are a physician or a parent who's seeking kind of non-traditional treatments for your children, some of the practitioners and physicians and things will propose what I would call non-standard medical treatments. And sometimes those non-standard medical treatments, particularly in a patient who has a diagnosis as rare as your children do, sometimes those experimental treatments are all you have because there's no double-blind, placebo-controlled 100 trial scenario that your children would ever fit in. And so people don't really have a good pathway. A lot of the medicines that they would choose are kind of in that pattern of clinical judgment and everything. That could raise all the way from, a seizure medication that's maybe used in another diagnosis, but ends up being used in your children, could also be all the way to the other end of people proposing really obscure medications that are real off the fringe, and being proposed for something. Those are, for me, very difficult scenarios. We do have to walk a little bit blind sometimes with complicated patients and use medications in our best judgment. So that's somewhat normal for physicians who take care of complicated patients. But when people are promising that they have some cure or drug or something that they're going to do for your patients, your children, that is not proven and is expensive, and they're the only people who do it, those always are red flags to me. So I'm not a big fan of people who are proposing things that are really kind of off grid, but are medicines used off grid. And some people would call that complementary or integrative medicine. I actually wouldn't, but there are people who would put those in that same pile. There's also what we would call nutritional medicine. So nutritional medicine would be diets, vitamins, supplements, herbal products, things like that. And there are plenty of people out there. We have a supplement store that we use, but I know that a lot of my colleagues who do this kind of work can sometimes propose very heavy, high doses in lots of amounts to my special needs kids. And some of my families will come in with 20, 30 supplements that a practitioner has put their children on. And that's a bit of a red flag for me as well, because one, obviously that's very expensive to buy all those products. But the bigger issue for me is that children who have genetic disorders in particular, their body already has some stressors as it comes to detoxification and processing of things. And so they do need some support to help them in that processing. But remember that when we give them things, they have to process those as well. So there's always a walk cautiously, think carefully, make sure your doses are reasonable, make sure they're not too expensive and not going to break the bank of the family in regards to that. And what is the basis as to why we're doing this? Is it on solid biological ground? Does it make sense? Is it reasonable? And so I always like try to keep my families in a reasonable pile of supplements. We do use them, but I'm always conscious of the cost and burden of that too. And I don't want to overload the children's detox system with something that I'm giving them either. The the third group is what I would truly call like complementary and alternative medicine, like that's more traditional medicines like acupuncture or massage or osteopathy, um, movement clinics like Anat or you know, a good OT or brain balance or something that's working on students from that standpoint. These fields aren't specific to a diagnosis. So, you know, you don't, as opposed to like a medicine or even sometimes a supplement where you're like, this problem, I do this thing. Holistic approaches to medicine that are more manual and stuff have more to do with building up the inherent energy, vitality, balance, structure and function of an organism. And so they're not specific to an individual diagnosis. There can be applied across diagnoses, and when done correctly can be very safe, which is great because it's the one thing as a parent that you don't need to stress too much about is going to harm your child. You can enter into those and say, like, we can try these for a while and see if my child gets benefit from it. And I think that's really important, that safety is always first. So those fields are really great options to add into the care of your patients. Sometimes that which of those you pick is sometimes determinant on who's available to you. There are very few osteopaths that do what I do. I'm biased to, of course, think that we're pretty amazing, but there's very few of us. There's not very many in the country. And our treatment, you know, works on using very gentle work with our hands to help relax the muscles and reorganize the nervous system, help the nervous system calm down, help it regulate the tissues that it's regulating, of course, and help it coordinate with the body as a whole. So, you know, osteopathy can help anything from constipation to seizures to muscle tightness. It's really a whole body kind of treatment. And depending on each individual patient, we'll adjust our treatments underneath our hands depending on that patient's mechanics and what's happening with them. Um, but but you may not have an osteopath near you. You know, you may have a really great acupuncturist who does like non-needle things for children, or you may have a fantastic cranial sacral therapist or a really good massage therapist, or you may have some other modalities. So you really should kind of channel into what's around you, and that might take a little bit of time to ask around what's available. No matter which of these three, like kind of complementary or alternative or integrative treatments that you do for your children, the first thing I always like to remind people is wellness is more than what you eat. Wellness is more than what therapy you take your children to. Wellness also includes families' financial status. It also includes um, what uh, strains they have, what emotional strains, time strains, what availability they have. Because at the end of the day, your child is still your highest priority. And if the treatments are a financial burden to the family, that's not in a child's best interest. If we're spending all day driving around town in therapies and we aren't allowed to play and have a relationship with our family and enjoy ourselves as a child, that's also not good for a child. Um, so every time we make these decisions, they might be unique to each family based on those variables, like what's around you, you know, who's available, what kind of, how does it work into your schedule, how much will it cost, is it reasonable? Um, and you have to layer that on top of, you know, would this vitamin be good, or would this therapy be good, or would this school be good for my child? Because those are as important to the wellness of your kid as the other aspects of what you do for them. And as I've interacted with my patient that has UL's diagnosis, one of the things that has come up several times in our conversation, which I really wanted to bring up as well for you all, is I was fascinated when we finally got the kind of list, which I was so glad you guys were doing for each other. It's so helpful of the cases of each of the patients that were identified in your little group, of what the kids looked like and how old were they and what were their medical problems and what things were shared probably by the genetic disorder and which things were secondary to just life. And there were patterns. There were patterns in what I saw in those diagnoses. I mean, one of the things that was most powerful after the first meeting that she came back from was, oh, like all of these kids really, really struggle to talk. So we should get her a talking device sooner than later. And that's the kind of thing that you should get out of these group meetings together is sometimes when you have a small child, you think, well, maybe they'll eventually gain regular speech. And so you don't try to teach them sign or you don't try to teach them on a lamp device. But if you know that speech is unlikely to be good for them, then the sooner you teach those things, sign and lamp devices, the better they will incorporate them and map them into their brain as a normal activity. So when you look at what you gain from each other in this meeting, those are some of the things that you should look at. Like, which things should I expect might be consistent across our diagnoses now that we've all found each other? And which things might be related to choices that people made in their medical care? So obviously, if all the children are not talking no matter the age or talking very limitedly, then we need to kind of plan that we may not talk. So that's why we got her lamp device soon. There were other things that were common, but made me kind of sad because I thought, um, this is, um, probably more of people didn't know how to navigate when they were babies. Um, that whoever was dealing with this child when they were under a year didn't really fully understand how to take care of a special needs child. And that's what having a small young child introduced into a special needs practice can be so powerful, because some things, um, when identified early and managed differently, might not have as bad of an outcome, like whether a child can eat by mouth or whether a child gets PT and OT and things early enough to kind of overcome some of those discrepancies. Um, so making sure that you have your child as soon as you know they're delayed, like plugged into a lot of therapies and with someone who knows how to manage a special needs child. Some of the things that I saw in those lists were things that sadly I think could have been avoided if maybe the person when they were young knew how to manage a complicated kid. Sometimes people are just trying to keep a kid alive while they figure out what's wrong, which is a completely different goal than having an optimal outcome for a child. And it's easy to fall into if you don't know how to take care for special needs kids. It's easy to be like, I'm not sure what's going on here. I guess I'll put an NG tube down and just feed this baby that isn't growing well. I have had enough experience now with children who have various forms of dwarfism that very early on, for Arden, I said to her mom, like, she kind of reminds me of some of my other kids with dwarfism. And she didn't have a diagnosis yet, and we didn't know what she exactly had. But the way that trying to feed her still didn't equate with the growth that we expected, and those kind of things really gave me some early on experience with saying like, oh, she may never grow like the other kids. We should focus on why she's not growing and not just keep trying to like shove calories into her. So that's a really good kind of real-time example of how a complex medical home can maybe help navigate taking care of a kid who has a lot of special needs. I wanted to kind of lay that groundwork of like words that we're talking about, like, off-grid medical treatments versus nutritional therapies versus like kind of traditional medicines. I wanted to kind of lay the groundwork of complex care and why you would want someone who understands complex care taking care of your primary care. And then I kind of wanted to open the grounds for you guys to ask me questions like within these like umbrellas of what interests you and what you think and what so I'm open to some questions.
Hi, Ali. I've been watching our comment and question section. So far, it doesn't look like there's anybody that has a question just yet. It looks like there was a comment that someone said that that they have the Gillette Complex Care clinic in St. Paul, I think Minnesota, is great, is a good option for us, and that's what Kathleen Hartman wrote. I had written a question to you, but you kind of answered it during your presentation, and I was going to ask if you could specifically explain what osteopathic medicine is. I think you kind of covered that in your presentation, but for some people who may have missed that or may not fully understand what that is, if you could explain that a little more.
Well, sure. I mean, I can definitely take more time with that. So osteopathic medicine is, DOs are doctors of osteopathic medicine. Um, and I like to equate a DO degree kind of like the difference between public high school and Catholic high school. Um, we get all the same medical classes. We're actually required to have all the same medical classes to be a fully licensed physician, which we are. But we have another class in addition to what the MDs would get, which is a philosophy of medicine class where we also learn how to work with our hands and think of structure and function and how it relates to the body. One of the things that DOs say is that, the body is a unit that's supposed to work together. It has an innate ability to heal itself. That it's our job as osteopathic physicians to walk alongside of a body and say, like, what obstacles to health are here, and can I help it function to its best ability since it's trying to heal itself? That's kind of the basic tenets of osteopathy. Just like you could go to Catholic school and never go to church another day in your life, we have DOs that just aren't holistic at all when they graduate, and they go through regular MD residency programs, and they would be indistinguishable to you. Then there are people like me who have committed myself to fully learning the traditional skills of working with my hands as an osteopath, and actually, it's a whole second specialty for me. So I have a pediatric residency, board certification, and a board certification in manipulative medicine. And for those of us, it takes us a lot of years to learn to train our hands to do those things. And then in between those two extremes, we also have a lot of people who, like, maybe, if you were to take it back to the Catholic school analogy, like, they go to church, but they're not like diehards, but it does change the way they see the world. And they approach the world from a different perspective. And many people will say, and there's been data collected about this, and research studies and things, that DOs tend to carry with them throughout their whole educational career a benefit as it comes to empathy to the patients and better doctor-patient relationships. It's part of our training to practice how to talk to patients. They used to put cameras up and grade us on our skills of talking to patients. But that actually equates to better patient skills when you get out. So because of those tenets being intertwined in our educational process, even if you meet a DO who's a cardiologist, many times people will say, that DO's that cardiologist is a little bit different. And sometimes they don't even recognize, they don't know to look at the letters on their names. But if you look closely, you'll often find that the DOs tend to be a little bit more patient-centered, but not always. And then we have some MDs that are, have taken time to train their hands in either manual medicine like Reiki or massage or craniosacral therapy. We actually have some DOs that are MDs that actually train in osteopathic medicine as well. And so those MDs, I would say, would be like someone who went to public school and still is a Catholic. It's my phone is telling me it's mad, it's angry. It needs to cool down, it says. I guess I ran it too long. So let me see if I can do something to make it happy here. Can you still hear me and see me?
We can hear you, but we can't see you.
Okay, so it's mad at me. Okay, I'm going to give up here for a second and turn the camera off. Maybe it'll cool down. So,
Sorry, you are muted, so we didn't listen the last 30 seconds.
you hear me now? There, I turned my video off and left my sound on. Can you hear me?
Yes, we can hear you.
Yes, we can hear.
Fantastic. Okay, maybe my phone will be happier if it's taking a rest from its video. So when you do osteopathic treatments within cranial osteopathy, which is the most used form within children, what you're doing actually is you're using your hands to move and palpate the tissues underneath you. And what happens is the signals that go from the tissues to the brain and then back down to the muscles are what we would refer to as like a reflex arc. And just like you see that hypertonicity in these kids, that's where their brain is sending a too strong signal out to their muscles and making them too tight. We're constantly, our posture, our motions, everything that we do is a balance between the way the information comes from the muscles to the brain and then back down to the muscles or back down to the organs too. I mean, that would be true of the organs. So when we're working with osteopathy, we're actually very gently moving the tissues in a way that changes the way those signal arcs happen. And so even though we are not using a lot of force, oftentimes it still changes the way someone's posture or blood flow or fascia within an area flow. When we work on the cranium, we actually are, when the young children are young, we actually are working on how the skull plates are aligned with each other, and then how the blood flow and the CSF flow is coming in and out of the head as well, which helps calm the nervous system down. One of the most profound aspects of osteopathy, when you look at it from a physiology standpoint, is that it calms the sympathetic nervous system down and allows the body to go into a more parasympathetic state, which is what we call rest and digest. So for a lot of children with special needs, they have a very overactive system, and you see that in your kids too, and that is shared with the autism community, that overexcitability and difficulty calming down. And the osteopathy helps bring a more calmer state. There are other things that do that as well, but osteopathy is one of the things that can do that. So for neurologic patients, one of the most powerful thing of osteopathy for them is the calming down of the nervous system. So you see that some patients have less seizures, some patients have less tonicity in their cerebral palsy, some people can coordinate their reflexes better and how they walk better, and have more coordination around difficult tasks. And so that's our goals as we treat a patient with our hands. And then people oftentimes hear about cranial sacral therapy. Cranial sacral therapy was actually founded by a gentleman who was part of the training that I was raised up in. He was a DO. He was frustrated there weren't more of us learning how to do this skill, which is true. There aren't enough of us learning how to do it. So he decided that he would make it simpler, and it's called a therapy because he legitimately saw it like a PT or an OT in his mind that would be working under the jurisdiction of another osteopath, like an extender, the way my nurse practitioners are my extenders. Once he started teaching it, it kind of got to be its own organism, and now there are far more cranial sacral therapists in America than there are osteopaths. And they can range anything from a lactation consultant to a speech therapist. Their training is very, very diverse. And I have met some cranial sacral therapists who are excellent, and I have met some that I would not let near my children in a heartbeat. So they vary quite a bit in their skill set, because the teaching is much more watered down. But they are a good example of someone who you might be able to find in your community that would be a non-physician who might be able to do this kind of work. Just be aware that it's not really the same thing. It's a simpler version of what we do. So.
Okay, thanks, Allie. We had a question. We have a couple questions that came in that we can ask. So it says we have a where did the question go that I was just looking at? We have one here that says, what specific questions would you recommend asking when interviewing a new primary care doctor or specialist to build your medical team?
The first question I would ask, and you could even ask in the community, like, is there someone who seems to have a lot of special needs kids? And then when you meet that doctor, you can have an appointment with them. A lot of times physicians want something to discuss at that appointment. So um, some will let you come without the patient, some will make you bring the patient. If you want to talk about your child in front, not with them there, you could always bring someone else and let the doctor like examine the patient and then let them leave. And then you can get ask your hard questions if you want, if you think that that would matter to your child. And I don't like talking about all their problems in front of them if I can. But the biggest question would be like, how comfortable are you? Do you have a lot of patients that have rare diagnoses? You could bring up maybe one of the problems you have and what contribution that they might be able to add that the specialists aren't adding, and which things would they feel comfortable managing without a specialist. There are certainly a lot of things that I manage in home that probably other pediatricians would refer out for. And every time you can get something done at your primary care doctor, that's one less parking garage and drag into the hospital. I mean, some of these, specialty appointments seem so silly to me, because really the primary care doctor should know how to do those things. So sometimes when I meet new patients, I'm like, what, you see dermatology for your child's like eczema and like what, like I can take care of that, so kind of figuring out which things they might be able to pull off your plate so you don't have to have so many different people involved in your life. That would be a question I would ask. And if you have something that's interesting to you, like if you want to do osteopathy or acupuncture, or you want to try a diet for your child, I would also kind of ask them how they feel about that. There are some physicians that have a really happy attitude, and a lot of what I've learned was because I just had a happy attitude. I was kind of like, well, you can try it, tell me how it goes. And I learned a lot from my families who tried things I had never heard of before. Other doctors get like kind of weirdly red in the face and like angry about it. And that is a real good sign that you are not with the right person. um, it's unfortunate because there's even doctors I know that are friends of mine, like kind of like a social friend, like I enjoy them as people. And some of them are even very kind. I mean, nice. There's a gentleman that was one of my favorite people, wrote several of my evaluations in residency. His daughter had had a major car accident and herself had a lot of needs. And he was just kind and he cared about his patients and he was super sweet. But if you brought up any topic of vitamins or a parent who didn't want to vaccinate or whatever, he just turned into someone that I hardly recognized. I mean, he would kind of get red-faced and angry, and it was really sad to watch. And if you have things that you want to do for your child and you want to see how someone's going to react to you trying those things, sometimes you can see it on their face really quick. And if they have a happy attitude about it, like, then they're probably the doctor for you. And if they act like you're the craziest person on the planet, they're probably not. So that would be the other thing that I would ask.
That's great advice. We have a couple more questions, and then we'll go ahead and take a break at about 11:55, so we can get ready for our next speaker, and people can get something to eat or drink, or they can take a break. So one of the questions are osteopaths covered by insurance, or is this considered to be an Eastern type medicine?
And so I'll answer that. Oh, is it part of that too? I'm sorry.
No, I was just gonna read off a second question, but you can address that one and then I can do the next one.
Good. So first of all, really important to know, although I put osteopathy in a similar category as like acupuncture and things, like osteopathy is actually American. Came from Missouri, Kirksville near St. Louis. It's an American heritage field. It is covered by insurance, slightly different in each state. So Ohio has really great coverage for it. We have a strong Ohio Osteopathic Association that has really fought hard for us to get paid for what we do. Some physicians choose not to take insurance, particularly because they are in such high demand. They oftentimes will take cash because it is a covered service, however, though, because it is like, it's got a Medicare code, like it's covered by Medicare, it's covered by Anthem, it's covered by Aetna. You can submit it as an out-of-network charge, which means you would get some of it back even with a cash-based practitioner. I personally take insurance because back to the whole wellness is about more than just what you do. I don't like putting financial burdens on my patients, but that's real hit or miss. And just to be fair to some of my colleagues, there are some states where they just hardly get paid at all, and they have to take cash. So.
Okay, thanks. It says many of our kids struggle with muscle spasticity in their legs and their feet. Do you have a best practice for this condition? Also, are you familiar with QRI, cold laser therapy?
Describe to me in which way they were using the cold laser. Like, it's used in a couple different ways. Is it something this family is doing and they can describe it to me, or they just heard about it?
I'm not sure if Carol, if you're still on listening, if you could maybe just type in a response to that. It says it's connection with, she wrote back, in connection with spasticity. And the question just says, also, are you familiar with the type of therapy? She says that they're using it with connection to spasticity and reflexes.
Okay.
What's her response?
Okay, so there are some cold laser treatments that actually like kind of run along a muscle to help it stretch. And I have not had any of my patients do that before. I think it's interesting, but I have not had anybody do it. So I have no personal experience. There's also some cold lasers that are used on the acupuncture points as part of the NAET system of treatments. And so then they're more like focused on like trigger points or spasticity points or acupuncture points. And I've actually seen that in action, and that is actually very interesting to me and pretty cool. So they're used in a slightly different ways depending on who's using it. And as far as the spasticity goes, the spasticity, in my experience, in my one DR patient, is that, that is that misfiring of like telling the muscles to fire too strongly. And some people think of it as being similar to cerebral palsy, but it is not. Cerebral palsy is where, from a physical therapy, like a PT standpoint, they would probably treat them similarly with braces and stretching and things like that. But in CP, you actually have lost the signal from the brain that controls that area appropriately. So like either the nerve between the brain and the foot have been disconnected, or there's an area in the brain that got damaged and it's not fully connected to the brain, so the foot's acting independently. Like a cerebral palsy child might point their toes, and that is because the hamstring is not firing correctly and it's over tight. That notion that we were talking about, efferent and afferent, the signals coming out of the muscles to the brain and back are not completely intact, so the muscle's behaving on its own. So sometimes physical therapists will assume that high-tone children are like CP children, but in this case, that's not true of your children. Your children have a general high tone, and this goes back to the benefit of knowing something about the disease process as you go back to your practitioners and being the strong advocate for your child, because the wrong PT or the wrong doctor might say, oh, this is like CP, but it's not really like CP. It's a full whole body hypertonicity. And so, from a holistic standpoint, I'm going to use the same, stretch the muscles, work on the fascia, try to get the tone down, try to get the sympathetic system down. I'm hoping that as you guys gather together as families and as people who understand this disease, we might be able to find out, are there medications that will calm that overstimulation down? Are there things, because it's not specific to one muscle group, it's like a whole body hypertonicity. So I do think that, if you're skilled at what you're doing, you will notice the difference, but there's probably a lot of people who will think they are the same. And so for me, that's one of the reasons why the osteopathy or like the acupuncture or things might work really well for them, because what you're trying to do is you're trying to take that over anxious neurological system that's sending the whole body into high tone and try to calm that down as a whole system instead of just individual muscle groups or individual areas. Does that help?
Yeah, Carol, hopefully she answered your question. If not, we have her information and we'd be able to put you in contact with her if you feel like you need to discuss it more. Looks like we have one last question before we head on to our break before our next speaker. It says, our PCP is very open to trying various things, and as a pediatric nurse myself, we work well together. There are times where I feel like maybe we need something more, maybe a DO. If a DO is not close to home for sick visits, is it reasonable to keep a MD on board?
Absolutely. Absolutely. That having the reason why I started first with the medical home conversation is I really think it's the most important. And as biased as I am to what I do, I know there are very few of us that do it. Because even within my field of people who use our hands, most of them do not do primary care. So, they work with osteopathic treatments the way you would see a PT, but they're not your doctor. And so I don't necessarily think that you will find a me where you are, that you might, but there's very few of us. So having a good medical home is your first step, and then which therapies you decide to put into there would be really important for you. And then if you want to find someone who does cranial osteopathy, and the docs that do what we do are very good with special needs children, it's just a very powerful tool. There's two websites with provider lists on them. One of them is cranialacademy.org. And just like it sounds, cranialacademy.org. And the other one is the Academy of Osteopathy.org. So instead of fully osteopathic, that would be osteopathy. So Osteopathy. So Academy of Osteopathy.org. And those two organizations have like a click find a physician button. And there are members within there that don't do a lot of cranial or children, and there's others that do. So before you were to drive somewhere, I definitely want to get a hold of the office, ask them if they're comfortable with children with special needs, and if not, did they recommend someone who is. But we do have docs scattered all around the country, and it is not uncommon for people to drive or travel to see osteopaths. That's a pretty common thing. And if it's close enough that you can make a drive and see an appointment from time to time, that's great. Other times, I know some of my colleagues have families that will fly in for a couple weeks and get several treatments, and then they'll come back in 6 months or so and do it again. Or drive, further and stay in a hotel and get several treatments in a row. So those are options if you don't have someone near you. Medical home's always first.
Okay, great. It looks like that was all the questions that we have for this session. Thank you so much for Allie for coming and taking your time and speaking with us and helping give your insight and your opinions, and hopefully it was helpful. So we're going to go ahead and take about a 6 to 5 minute break so you guys can get some lunch, get something to drink, stretch, check on your little ones, and then we'll be back for our next speaker in about 6 minutes. So we'll see you soon. Thanks, guys.
Bye, guys.
Hello, Megan. You're mute.
I haven't used Cisco as much as the other one, so I'm not as aware of where everything is. So let me just look at where share screen is.
Right in the bottom, there's a big share button.
Okay. It is not letting me share, so I'm supposed to change some settings.